Tonight, more folks are sharing their concerns as House leaders are trying to push through President Trump's so-called Big Beautiful Bill. And we've heard figures before that the legislation could cut Medicaid for more than 500,000 North Carolinians. The president argues the bill is cutting wasteful government spending. Experts warn, though, it could hit folks with pre-existing conditions pretty hard, especially those living with HIV or AIDS. WCNC Charlotte's Julie Kay is joining us now to talk about this. So, Julie, who would be most impacted and what are we seeing potentially happening here?
Yeah, this bill directly impacts those who benefit from Medicaid expansion. So it would limit the state's ability to fund that expansion through hospital assessments, which is the main way North Carolina pays for it. That means the 663,000 North Carolinians who rely on it could be left without coverage. For people living with HIV, the impact could be devastating.
A plea on the House floor heard across North Carolina.
Now, Republicans are about to make a mistake on health care and betraying a promise.
Senator Thom Tillis announcing his retirement and voting no on Trump's Big Beautiful Bill, warning too many North Carolinians would lose Medicaid coverage. That message echoing even louder at organizations like RAIN.
It's a really scary time.
Chelsea Golden is the CEO of RAIN, which supports people living with HIV and AIDS.
We do a lot of testing, which is all threatened in the bill.
According to AIDS United, 40% of adults living with HIV rely on Medicaid for treatment. The bill would also slash funding for federal HIV prevention and surveillance programs. Golden says those cuts come on top of ongoing reductions to research funding.
The funny thing about the entire situation is that there's really not that much communication. It's like it happens really fast.
She says it's happening just as scientific breakthroughs are within reach, like the newly approved PrEP shot.
They will be protected against any HIV exposure for 6 months, and they just go back. It's the closest thing to a vaccine that we have.
Golden warns rural hospitals will feel the impacts first, and that could soon ripple into Charlotte. That's why her message to lawmakers and voters is clear.
You will absolutely be impacted.
Now, RAIN also offers mental health support and housing development resources, but like a lot of nonprofits right now, they need donations and they encourage people to get involved if they can. Vanessa, back to you.
Julie, thank you for your reporting.